Keren, we're back in another lockdown now, but it seems that things are a little bit different this time round. What have you noticed that's different in terms of people's health focus?
In the first lockdown last year, we had a massive footfall of people coming in looking for immune remedies. I think because we were facing this virus, people didn't know anything about it and they were really scared. So they were coming in looking for elderberry, echinacea, vitamin C, zinc. We just couldn't keep enough of those products on the shelf. We still are having people coming in looking for these things, but actually I think the real focus and the real issues that people are experiencing right now are stress, anxiety, mental health issues, feeling depressed. I think we're looking at it being, 9 months in, people are exhausted and tired and just really, really struggling.
Yeah, it's almost like a chronic thing now, isn't it?
Yeah.
People are really at the end of their tether, people can't cope, and it's almost like this new imposition is almost like the final straw. So what can people do to help themselves?
There's a lot that people can do. I mean, we're getting lots of people coming in because they're really struggling even to get hold of a GP. I mean, it's understandable. GPs are now caught up in, dealing with more COVID cases, but also this vaccination programme rolling out is taking a lot of attention. So people are finding it hard to actually get in and have appointments with GPs. They're coming to us, they're looking for things that they can do to help themselves, over the counter, in a health food shop, and of course we're seeing people coming into clinic as well looking for extra support. But there are loads of different remedies that are available, and some of them, really, really effective. I'm, selling probably more things like rhodiola, L-theanine, lemon balm than I've ever done, and people are reporting that it's really making a difference.
And that's making a difference to their mental health.
Their mental health, yeah, and their physical health, because, if you're stressed out, then it's going to have a real impact on how you're functioning physically as well. So, stress doesn't just get our heads sort of messed up and overthinking, etc. It can impact your sleep. You can get physical symptoms, you can get palpitations, it can aggravate things like irritable bowel syndrome, make aches and pains worse. Stress tends to fire up and exacerbate anything that's actually going on anyway.
So for all these people who are not getting themselves to a GP, they're finding it difficult to get advice, what could they do easily that would help them?
Well, first simple steps, even before you go out the door and try and buy a remedy, is to do things like eat regularly, go out and get some exercise, try and get out in nature. We know that being out in nature immediately drops down the stress hormones. So even though it's cold, get out, wrap up warm and get some fresh air and exercise. Eating regularly is really important, because if you skip meals, then your blood sugar is going to fluctuate. And the first consequence of blood sugar fluctuating is that you're going to start going into adrenal overdrive. As your blood sugar drops, one of the fastest ways to get your blood sugar back up again is to give your body a bit of an adrenaline rush, because that releases stored sugars. So eating regularly, eating well, good balanced nutrition, cutting down on caffeine, perhaps doing a little bit of meditation, stop watching the news, because, all over the news is just constant negative stories. And I'd say get off social media, because, social media is a bit of a battleground at the moment, and, I'm trying to avoid it. I just think that it's impacting our mental well-being. So basically, do these sort of things at home, and then you can take some supplements and remedies over and above.
Yeah. Now, how do people find out that? I mean, I think that's great advice. But then how do people know what they should take?
Well, there's me saying avoid social media. You could still go on the internet and do a little bit of research, and there is some really good information out there. But think about visiting your local independent health food shop. You'll find that the staff there are really well versed in supporting people. There are medical herbalists up and down the country that could probably give you some advice as well. But a basic good regime would be, if you want to take any supplements, look at maybe a supplement that's got vitamin B complex in there, because vitamin B is really important for supporting the nervous system. Vitamin D, we're always talking about vitamin D for the immune system. It does actually help with serotonin as well, and particularly at this time of year, our vitamin D levels do tend to drop down. So if you're somebody that's prone to seasonal affective disorder and you're struggling, then boosting up vitamin D could be helpful. And then you could look at different herbal remedies that are there. One that we find works really, really well, and is probably our best-selling remedy, is a combination of L-theanine and lemon balm. Now, L-theanine is an amino acid that comes from green tea, and it has a really calming effect, almost instantly. I usually find with about half an hour of taking L-theanine, I feel really calm, really focused. It doesn't sort of dumb you down, it just makes you feel really settled. And the combination of L-theanine and lemon balm work on something called GABA in our brains, and GABA just helps us feel really, really settled. So it's great for panic attacks, anxiety, really taking the edge off sort of fearful situations. And I think fear is probably the key word that we could say at the moment, is that people are feeling a bit scared with it all.
Yeah. And then even if they go into a health food shop, I mean, are people there able to give people advice?
Yeah,
people serving in health food shops?
People serving in health food shops are usually incredibly well trained and are very good at giving advice. So I think they're a really good first stop for people if you're looking for just a remedy over the counter. I mean, they're armed with different remedies. We have rhodiola, which you've probably heard of. Rhodiola is an adaptogen that tends to, I always say, it keeps your foot off the accelerator pedal. It really stops you going into adrenal overdrive. There's herbs like passion flower, passiflora that you can buy over the counter. St. John's wort you can buy. You have to be careful with St. John's wort in case it interacts with any medication you're on. But again, you'll get that information. St. John's wort is only available as a licensed remedy, so inside the packet it's going to tell you whether it's safe for you to use it or not. What else do we have that's particularly popular here? Ashwagandha. Ashwagandha is an Ayurvedic herb, and again is very popular, and it is really adaptogenic. It supports restful sleep and stamina and helps you stay calm and relaxed in the face of different stresses. So there are lots of different remedies there. People that work in health food shops are very well placed to give you support. They're very safe places to go and shop because they're small, they've got better control on numbers going in, etc. You can also access people like myself, medical herbalists. At the moment, I can't offer face-to-face consultations, but we are doing Zoom consultations or telephone consultations. And we're actually about to launch a scheme where people can have small 10-15 minute consultations with us by Zoom, and instead of taking a consultation fee, we're actually going to make a donation to a food bank to try and support the local food bank and pay back something into the community. And that's just to give people that sort of acute medical care that they need, because sometimes you don't need a big in-depth holistic consultation. You just need something that's going to work and make you feel better fairly quickly. And that's what people are looking for at the moment, is stopgap help to try and get them through this.
Yeah, absolutely. And that scheme sounds fantastic. But then are there other things that you can do? I mean, people are in such different situations. Some people are absolutely on their own. Other people are with family. There are stresses that come with that. I mean, are there any other things that you can do within the home that might help?
Well, doing things like Epsom salt baths can be really helpful. Epsom salt's full of magnesium, and magnesium really helps us to calm down and relax. When we're under a lot of stress, we burn magnesium off at 100 miles an hour. And nutritionally, it's very hard to get enough in our diets nowadays because magnesium is in much lower quantities in the soil. So although if you look online and look at resources, you'll see that green vegetables are higher in magnesium, nuts and seeds are high in magnesium. If they've been grown on depleted soils, they're not going to have so much magnesium in them. So doing something like having an Epsom salt bath could be really helpful because you'll get some magnesium on board, you'll absorb it through your skin, and you'll also have a really nice soak at the same time. So doing something like that could be really helpful. Self-massage can be good. Using sesame oil in a massage, so maybe sesame oil and putting some lavender in there and doing a warm oil massage is really good at calming down the nervous system. So that's a traditional Ayurvedic way of supporting the nerves. Eating foods that are quite high in calcium and magnesium as well can be good. If you can tolerate dairy, then warm milky drinks can be really helpful, really comforting and settling. Meditation, mindfulness practice, do some exercise, yoga, get access to a Zoom class. I know it's hard and it can be difficult if you're by yourself to feel motivated, but taking that first step, just doing one thing, can make a huge difference to how you're feeling.
Absolutely. And just going back to magnesium, you can get magnesium capsules, but I think I'm right, you'll tell me if I'm wrong, magnesium is better absorbed through the skin.
I think it is. There are transdermal magnesium sprays available.
Yeah.
And the results that we see for people using those are absolutely amazing. And people could be taking a magnesium supplement orally. They come in, they purchase a magnesium oil, and they can feel a dramatic difference to what's going on there. I think some people struggle to absorb magnesium. If you don't have good enough stomach acid levels, so if you're on medication, say you're on something like omeprazole, you're not going to absorb so much magnesium. Or if you're older and you've got less stomach enzymes, you're not going to absorb it so well. And some people are sensitive to it because it can fast track through the digestive system. So, magnesium's great if you're constipated, but if you've got a bit of a loose bowel, it's perhaps not the best thing to take. So, you can actually absorb it incredibly well through the skin. So using a transdermal magnesium spray, which you can maybe spray on your legs at bedtime, or using an Epsom salt bath can be really good. We sell lots of magnesium sprays for people with restless legs, and that's one of the symptoms of magnesium deficiency. So you could experience restless legs, cramps in your legs, being dizzy, having palpitations. These can all be signs that you're a bit low in magnesium. And if you are, and you use a transdermal spray, you'll find that when you first put it on, you're really tingly, and that's literally your body really trying to soak it up. So that can be a good indicator that you're low on it if you have that initial strong reaction when you use a transdermal.
Yeah. So what else then can people do? And is there one go-to herb, let's say, that you might just use as preventative?
I have just one go-to herb? I've got so many different herbs that I use in my practice, and I've got certain favourites to use in certain situations.
Yeah.
So if I was looking at somebody that was feeling really, really fearful, then I might use Passiflora, because I think the key word that I think about for Passiflora is fear. If I'm thinking about somebody that needs a little bit more courage and resilience, I'll use borage, because borage really strengthens up the adrenal glands. And in fact, borage used to be given to people before they went into battle. It was given to men as a battle remedy to make them feel brave. And I think probably quite a lot of us could do with feeling a little bit braver at the moment with what's going on. There's a herb called skullcap. Actually, that's not so readily available over the counter, but from medical herbalists it's available. Skullcap is great when you've got a head like a record player that can't switch off. So I think depending on the situation and the symptoms, I think you'd want to try and match herbs specifically. Although if you're just buying something over the counter, I think rhodiola is a really good one to have to hand. I think it is one that works really, really well. It's very safe and effective, and will often be a key remedy in my herbal prescriptions.
And just a thought that's going through my head just now, what about medicinal mushrooms?
Yes, medicinal mushrooms. Well, I'm a big fan of mushrooms. Lion's mane mushroom can be really supportive to the nervous system. So lion's mane can be helpful, and particularly good if you're going through the menopause or if you have a neurodegenerative problem. Cordyceps is my absolute go-to when it comes to mushrooms. I take cordyceps every day, and I have done throughout the whole pandemic. I'm using it because it's supporting me through my menopause by supporting my adrenal glands, but it's also a great respiratory tonic. We want to try and protect our lungs at the moment, but it's a fantastic adaptogen. I find that when I take cordyceps, I'm incredibly resilient. I mean, I've just come through, I've come through the pandemic. We've all been going through the pandemic, but it's been a really busy year and tough year for us here, working through all these different restraints, and we've had staffing changes, etc. going on, and cordyceps has just kept my stamina up right throughout all of this. So it increases your stamina and your resilience. So it's a really good adrenal tonic. And basically your adrenals they're like your Duracell batteries for keeping you going. If you're chronically stressed, then your adrenals do get really depleted, and you really want to try and look after them. So cordyceps is good on that front. Rhodiola really supports the adrenal glands, which is why I think it's a great tonic to take. Ashwagandha does as well. So you really want to keep your adrenals resilient, because they're tied into your nervous system and your emotional responses, but they're also really tied into your immune system as well. Good adrenal function gives you really good resilience and helps to reduce inflammation in the body. So it's really important to try and look after them.
Just explain very briefly what the adrenal system is.
Well, your adrenal system, it's your fight or flight system. It's about, the adrenals do three main things in the body. So they produce adrenaline and noradrenaline, which is fight or flight. they produce cortisol. Now, cortisol is natural steroids, and we all know that steroids are used, they're being prescribed in medicine, and actually they're using steroids to treat COVID because it reduces inflammation. So steroids are used in your body to calm down immune responses and immune inflammation, and to support the hormonal system. And the adrenals also regulate out the levels of potassium and sodium in the body as well. So those are the three sort of main functions of the adrenal glands. But if you think about the hormonal system and what it does, and the adrenals in particular, the key function of the whole hormonal system is about survival, and it's about our immediate survival in danger. It's about our metabolic survival. It influences everything that happens in our body, and our reproductive survival as well is tied into our hormonal system. So our hormonal glands, our adrenals being particularly important, have a really potent effect on how we feel, because it's about survival.
Yeah, so actually key right now for everybody. Okay, so we look after our adrenal system. We take a number of herbs that you've mentioned, which sound brilliant for different aspects of what we're all going through. Is there anything, any advice that you would give overall to people who are really struggling right now?
Reach out and talk to people, connect with other people. There are services out there. If you don't have friends or family that you can talk to, there are different services available. There's phone numbers, you can go online. There's Samaritans. If you're feeling really isolated and alone, reach out, connect and speak to somebody. I think that's really, really important. We're social beings. We live in communities. We've always lived in tribes and communities. And I think you need to try and reach out and get some support from somebody. And I think that's what the real difference is in this lockdown from the first time around. We rallied together. We were out clapping for the NHS together on our doorsteps. People were really... it was like when, the Beast from the East came along a couple of years ago and everyone pulled together. And there is still that happening, but also there's a lot of division going on as well. And I think we have to break through that division, stop attacking each other on Facebook, and start loving each other a little bit more.
Couldn't agree with you more. There's a really different flavour to this time round,
Absolutely.
Isn't it?
Yeah, I think so. Yeah.
So that is actually maybe a place to start. Just reach out.
Yeah, reach out. Speak. Support other people. Treat other people with the respect and consideration that you'd want yourself. And let's all just show each other a little bit more consideration and care, because everyone is going through it. People talk about we're all in the same boat. No, we're not all in the same boat. We're in the same storm. Some of us are in very different positions, and some of us are in... When I feel I'm in quite a privileged position, I've got, my family around about me, I've got a really good support network, I've got a business that hasn't had to close down, which is why I'm trying to reach out and give people support as best as I can, and do things like the dropping the service with the donation to food banks and the short consultations. It's ways that I can try and help people and give them some support. So I think we all need to be doing that if we're in a position of privilege, and strengthen our communities, because I think that's the way we come out of this in a much better place. Yeah. Send out the lifeboats for people who need them. Yeah. Fantastic. Keren, thank you very much once again. Brilliant advice, brilliant information, and here's to us all getting through this in a very healthy way.